bowel overgrowth. So let's go and have a look at diet. I'm going to particularly focus on 4 different diets that have been used for SIBO: the elemental diet, the specific carbohydrate diet, the GAPS diet, and more recently the FODMAPs diet, and we're just going to look at the research behind those there. The elemental diet is actually a diet of hydrolyzed nutrients that are reconstituted in water. I've just cited the name of one company, Vivanex Plus is the name of it, and these are administered 3 times a day in replace of meals. This is done for 2 weeks, and it's shown in research to have an 80% success rate in patients with small intestinal bowel overgrowth. Now, the initial thought was that the reason they're getting such a great success rate is based on starvation for the organism. So in other words, we're depriving the bacteria in the small bowel of carbohydrates and other sources of food. Remember that bacteria primarily are going to be using carbohydrates as a source of fuel. So starvation, death, reduction in numbers, improvement, that was the rationale. Underneath that now, we know that there's other things happening when we give the digestive system a break with this elemental diet, and one of those is increased bile output. What is actually shown from a couple of studies is that the ingestion of an elemental diet can produce a dramatic increase in cholecystokinin and consequently gallbladder emptying. There's another rationale too that prolonged this diet in terms of deprivation of solid foods can accentuate jejunal secretion of immunoglobulins, and from the research they know that this can happen as soon as 20 minutes after jejunal perfusion of an elemental diet, and what we start to see then is significant increases in both immunoglobulin G and IgA. And again, this is also something that may help with the increased success rate, because if we've got our innate immune system actually upregulated, we're also going to have another prong of attack for bacterial suppression. And the other thing that we actually have seen, another proposed model, is it may directly affect the bacteria of the GI tract. Early observations of the effect of an elemental diet on stool and microflora actually show that this diet significantly reduces coliforms, enterococci, and Bacteroides. And this same study showed that the longer the subjects were on the diet, the lower the bacterial counts. And there has been some other research, 4 other papers actually, that have confirmed this data. So that is one. I think it's probably the fastest way to look at assisting someone. If you were going to be suggesting a patient go on an elemental diet, I would really encourage them to be removed from their daily or routine environment. Almost treat it like a sort of 2-week vacation, go off somewhere, because you don't want to have them influenced by food. You don't want to have them under undue stress either as they go through that process. And I have captured this here as well. I'm not going to, it's there for your reference. It's a PubMed article that was free for download, so there are no copyright restrictions. But this is the study that showed a 14-day elemental diet is highly effective in normalizing an abnormal lactulose breath test in IBS subjects, and of course they get a concomitant improvement in global IBS symptoms. Now, a specific carbohydrate diet is not foreign. It actually had its origins back in 1951. It was Dr. Sidney Hass who had done a lot of work on it, and back then it was actually well accepted by the medical community and all over the world. But as they discovered celiac disease, he was initially using it for celiac disease, as they discovered that celiac disease was a gluten intolerance or enteropathy, this diet kind of got forgotten and pushed to the peripheries. And it was brought back to life by Elaine Gottschall. She's a biochemist following the success of this diet with her daughter. And over the years now, thousands of people have used this diet with great success. Now, the goals and the rationale of this diet is basically reducing microbial quantities, therefore reducing toxic byproducts, therefore reducing mucus production and increasing carbohydrate digestion. So it works on the rationale that when we have got a high intake of carbohydrates in our diet, they become the preferred substrate for the microorganisms. You get overgrowth